Okay, right. I'm just going to carry on and introduce you, Martin. And hopefully we can sort it out in the background. So welcome, Martin, who's going to be talking about social return on investment, highlighting the value of public health interventions. Fire away, Martin.
Thank you very much. Hi, yes, my name is Martin and I work in public health for Manchester City Council. And today I'm here to share the insights on social return on investment and what I think is a really powerful framework for understanding the broader impact of our work. The guidance for this comes from the Institute of Social Value in their document, A Guide to Social Return on Investment. And I'll walk you through how we've applied this methodology to evaluate public health projects for Manchester City Council and how it helps us measure not just financial outcomes, but the real social value created for our communities. So what I'll be covering will be what is social return on investment, what it can help you do, how we've used it in Manchester, and what we've learned along the way. By the end, hopefully, you'll see how this approach helps us measure not just outcomes, but the difference we're making in people's lives. So, what is social return on investment? Basically, it's a framework for measuring and accounting for social, economic, and environmental value. It helps assess the broader impact of activities, particularly in public health, where initiatives often create lasting community benefits that are hard to quantify. By applying a set of principles, social return on investment promotes consistency and shared language around concepts like impact, returns, and value, while recognizing that what matters varies across people, situations, and cultures. Its goal is to reduce inequality, prevent environmental harm, and improve well-being. So what does it mean if you're working in a local authority? Well, budgets are tight, and we need to show real value for every pound spent. Old school methods like cost effectiveness and cost benefit analysis are useful but limited. Social return on investment looks at the bigger picture, social, economic and community impact, includes voices of all stakeholders and turns impact into a simple ratio, e.g. £1 of intervention creates £3 of social value. But it's not just about money, it's about the stories of change backed by the data. So why does this matter for public health projects? Well, public health interventions often boost confidence, well-being and community life. Social value captures benefits for people, families, communities and the economy. The bottom line being, moving beyond traditional metrics gives us a fuller picture of impact for residents. So what does a social return on investment model look like and how should it be implemented? So the model was developed from social accounting and cost benefit analysis, as mentioned before, and is based on 7 principles. Involve your stakeholders, engage those affected by the activity to describe the changes. Understand what changes, and this is identifying intended and unintended positive and negative changes for stakeholders. Value the things that matter. Include only what is material, so provide enough information for a true and fair picture of impact. Do not overclaim. Calculate net benefits, test sensitivity and avoid exaggeration. And most importantly, be transparent and verify your results. Seek independent assurance to ensure accuracy and credibility. It all starts with establishing scope. This defines the boundaries of your analysis by clarifying its purpose, available resources, and measurement priorities. This ensures the analysis is realistic and achievable. We then go to mapping outcomes. An impact map, which is the structure of a social return on investment model, shows how resources, inputs, are used to deliver activities, which are the outputs, that lead to stakeholder outcomes. This relationship, known as a theory of change or a logic model, illustrates how your intervention creates impact. We then move on to the evidence and value. This step involves defining indicators, collecting data and assessing impact to ensure credible results. Develop outcome indicators. Examples, improve well-being, salary increase, better financial circumstances, or improve school attendance. Collect the outcomes data. Decide how to measure, who provides the data, and the scale of the impact. Determine duration. How long do outcomes last for? For education, it may be a few years, but for well-being, potentially it could be lifelong. Assign a value. Use established costs and benchmarks to apply financial proxies to indicators, and then establish your impact. Avoid overclaiming by estimating dead weight, what would happen if your project didn't happen anyway. Displacement, does it replace any other outcomes? Is it affecting anything else that we're doing? Attribution, who else contributed? Not all your project's outcomes can be aligned with your project. And what's the drop-off? Does the effect of your project decline over time? You calculate this impact, and only after considering these factors can you measure the true effect of your intervention. This reduces the risk of investing in initiatives that don't deliver. So, how did we use it as part of a project in Manchester? So basically, through our stakeholders, the project I'm focusing on contained one commissioned organisation, which limits stakeholder numbers but simplifies engagement. They've been highly engaged, open to learning and committed to continuous improvement. As this project was inherited, most initial stakeholder engagement was complete when we started on the model. The organisation provided detailed monthly quantitative data, making inputs and outputs easy to define. However, there are no typical service users, so outcome analysis is challenging. Factors like duration of change, dead weight, attribution and drop-off vary individually. Central tendencies like the mean, medium and mode are rarely quantified in mental health and youth work, and the two key areas of change for this organisation. Despite this, stakeholders have worked creatively with their data and expertise to develop credible best guess measures. So what are the positives? Well, the strong monitoring and reporting systems have streamlined the process. A positive, trusting relationship with stakeholders has made collaboration a lot easier. Some of the challenges with social return on investment was understanding the guidance. It comes from a 90-page document, which was initially difficult and took weeks to process. It's also extremely time intensive when done thoroughly, and trying not to double count proxies is very difficult to do at times. So what have we learned? Key lessons learned from the process: expect the unexpected. Stakeholders often reveal outcomes you didn't anticipate, highlighting the importance of multiple perspectives. Focus on what can be measured. Not every change needs a proxy. Avoid forcing measures that don't fit. Avoid overclaiming. Simple counts of service users and outcomes can misrepresent impact. Rigorous methods prevent inflated claims. Stakeholder engagement matters. Involving stakeholders deepens understanding and strengthens the credibility of finding, especially valuable when commissioning services. Social return on investment adds a lot of rigor. The social return on investment approach helps ensure accurate, balanced reporting of impact. So how can this process be used to support future projects? The evaluation model for year one of our project proved valuable. The insights gained from this process helped us develop a forecast model to strengthen the business case for years 2 to 4. So how can we improve accuracy? Treat the impact map as a living document. Regular revisions ensure greater accuracy and confidence in its validity. Account for optimism bias. For example, we reduced the outcomes by 25% and the return still remains strong. Focus on the descriptions before numbers. When reviewing changes, avoid looking at output figures like return values until you're confident the description is accurate. This prevents assumptions from being influenced by outcomes. By following these steps, you can create a more reliable and transparent evaluation process that supports decision-making for future projects. Overall, how can this help wider work programs? This methodology is a versatile tool. It helps shape strategic plans, showcase impact to secure funding, and guide investment decisions. Most importantly, it enables smarter choices about where to invest time and resources. This approach can help you improve services by facilitating strategic discussions and enabling you to understand and maximize the social value created by activities. It can help you by targeting resources effectively and managing unexpected outcomes, both positive and negative. Highlighting the importance of collaboration with organisations and individuals who contribute to creating change. You can identify common ground between organisational goals and stakeholder priorities, helping to maximise social value. And establishing a formal dialogue with stakeholders, ensuring accountability and meaningful involvement in service design. So this methodology helps organisations become more sustainable by raising your profile, strengthening your case for funding, and making tenders more persuasive. Thank you for your time. I'm happy to answer any questions you might have.
Thank you very much, Martin. Really good talk there. There's no questions in the chat yet, or the Q&A, but if those come through later, please do feel free to answer them just by typing into the chat function. But I've got a question. So you mentioned that the impact, the decisions on the Kickstarter projects was informed by this model. Could you say a little bit more and give us some examples about the types of decisions, whether you stopped things early because of the outcomes from this analysis, or did it lead to further investment decisions?
Basically, it led to further investment decisions. Like I said, with the first iteration of this model, we did an evaluative structure. So that was looking back over the first year to see what had worked well and what had not worked well. And basically, we used that, all the findings from that, to then write the business case to go into the years 2 to 4. Some things were non-negotiable and we had to continue with them, but it did allow us to stop a couple of actions and then maybe increase some of the previous interventions that were being more successful than we'd initially thought.
No, that's really good. And yeah, certainly with the programme that I lead, the ADI UK programme, having really effective evaluations has definitely made it easier to get future investment decisions. Thank you. We're better stop there now, but please do stay on, Martin, so that you can answer any further Q&A. And I think they are coming through now as well. But if we go now to our next speaker,